Hello all, I'm Janelle Jones and welcome to this month's collective TA. Believe it or not, but we're halfway through the FAFLC. Congratulations on all your hard work thus far. Today on this collective TA, we'll be joined by Claire Anderson from Chapin Hall, who will moderate a discussion around data sharing between TANF and Child Welfare. I look forward to hearing from all the presenters that we have on hand, and hopefully it'll spark some ideas within your program. So right now I will turn it over to Claire Anderson. Claire Anderson.
Hi, everyone. It's so good to be here. It's hard to believe we're halfway through. Congratulate everyone for all of your hard work and continued effort in this space. I guess I just wanted to start before opening it up for a conversation to kind of highlight 3 or 4 major points around data sharing, though this is not exhaustive by anybody's stretch of the imagination. When we think about sharing data across TANF and child welfare, I think about that as data, like I'm making our data systems work, but I also just think about that as information sharing and looking at data together. And there are a few reasons I'd really want to do that sitting in your chairs. The first is to gather a shared understanding of spending trends and outcomes across both programs to allow for a robust strategy development regarding the totality of the TANF block grant in your state and orienting it towards the first purpose of providing assistance to needy families so that children can remain at home. I find that when 2 systems have a shared understanding or a shared voice for directing how a program is administered, there's more power in that than being alone. I think we also need to understand the extent to which families who are eligible for or receiving TANF are being prevented from coming to the attention of child welfare or do come to the attention of child welfare. To what extent are we pointing TANF and child welfare prevention efforts sufficiently in what is traditionally sort of a gap in between these systems where families are falling through the cracks, so that we are really getting a good understanding of what's currently happening and what more could occur. Clarifying the ways in which let me say that differently. I think it's also important for both systems, both administrators, to understand when money is transferred from TANF to child welfare, how those dollars are spent, and is there shared agreement understanding about what that looks like and for whom. For example, consistent with the first statutory purpose, providing assistance to needy families so that children can remain safely at home, child welfare spending TANF dollars on prevention and family preservation makes complete sense. Spending those dollars on foster care placements might not make as much sense. So really understanding those things together. Increased access of TANF dollars for families who do come to the attention of child welfare. So the extent to which child welfare is really clear about who's eligible, who's receiving benefits, and the extent to which those benefits can be prioritized for families. And then last but not least, being able to track and monitor return on investment. There, as you all know better than most, there's enormous cost to child welfare system involvement in the lives of families, both in terms of real costs being spent in child welfare, but also long-term life trajectory and productivity costs that could be averted. And if I remember correctly, the very first day of this learning collaborative, I heard from multiple tables, we need to be able to articulate the return on investment. And so sharing data and information across your 2 systems and coming to some sort of shared agreement around what your costs are for not preventing families from getting deeper, first from being involved and then more deeply involved, and helping people to understand from your perspectives what the return on investment is when you wisely spend in TANF to prevent families, and wisely spend in child welfare to strengthen families. could make an enormous difference in how you understand what your roles are together. So I think that just sort of frames up a conversation. And I think we've got a little bit of time to sort of open that up and see how you all are thinking about data sharing and information sharing across your systems. What's working, what's not, and what would be most helpful.
Can I instead of putting out a statement, can I ask a question? This is my first attendance in this platform, and we've been implementing a TTCW program for a number of years. I think maybe 6 or 7. And we've been operating a TANF program since 1998. We have child welfare. All the programs are now integrated social services programs into one building, which in the past it was not, maybe a couple of years ago. And so because of that, we're now thinking in terms of system articulation. Basically, what is our system of care? How do we define it? How do we articulate that? And how does the Tribal TANF-Child Welfare Program interface between those two sets of services? The problem is that even though we say TANF-Child Welfare, what we realize, it goes way beyond just what we know as TANF as a program and what child welfare constitutes, because what we had before was a program that was basically adult services versus children services. Now we're moving towards integrating the two and using TTCW as our interface. But the problem is that when we talk TANF, we're talking one program. And when we say child welfare, that's not altogether defined because, of course, Children's Services has many programs, including Title IV-E, and now we're looking to add a Title IV-D program. So my question basically is, what regulations are there that aptly define how you can share costs to do any number of things, including data collection? Because we have on the Title IV-E side, we have an Eagleson platform that's collecting data, Title IV-E-B, and then on the TANF side, we have an Eagleson platform that's collecting TANF data. But we've not been able to figure out how to interface the two so they speak together and collect data in a sort of way where we can integrate and make decisions from that data as collected. So I don't know. That's my question.
This is Dana from California. I don't have an answer for you. I know I have colleagues on the phone, but that the fact that there's not, I'll call the word they used years ago, the interoperability between those two big systems, the SAWS, which is the TANF system in California, and CWS-CMS at this point is the child welfare system. There's just not interoperability, so you have to pull reports. So that's what happens. That's what RAD is important for at CDSS, is they pull reports. When the state staff asks for reports, they can pull it based on comparing the PIN numbers of the families. Same way with the counties. The counties have to pull reports and then download them into something. So it's been a challenge, and I've been involved with linkages and a TANF-Child Welfare, or CalWORK Child Welfare, what we call it in California, since 2007, and it was one of the first areas that we highlighted that is an issue for counties to be able to both plan, identify mutual families, everything. It's a challenge, and we had hoped with the new SAW system and the new child welfare system in California that it would solve that, but at this point it hasn't. So it's the lack of those two systems, as you said, talking to each other becomes a major barrier.
Yeah, I agree. I think a lot of times it has to do with the systems in the regions as well. Certain states have better systems that talk with each other. So it would be a question that you can reach out to your regional office about, because it just all depends on which systems they're using. Some are more updated than others. So, and I can assist you with that contact if you have any questions.
part of my question was there's a cost involved, like the lady, I'm sorry, I don't know, can't think of what your name is, but
Dana?
yes, she expressed that there was, there's a cost involved, it's a high cost, and so part of my question was, how do you share costs by virtue of a federal regulation? There seems to be no federal regulation that indicates if you're going to share costs between, say, TANF, period, and child welfare, how do you share costs? And I've been asking that of our program specialists forever, and there's no formula.
And I think that's part of what this learning collaborative is here to do, is to help you all think together about the ways in which you can, as Dana is talking about, create workarounds to find data review processes that allow you to see data together, even if you don't have interoperability. How do you think about these two funding streams, not as distinct silos from each other, but as accomplishing a core goal, which is to provide assistance to needy families so that children can remain together with their families at home? And so we're going to spend a little bit of time here talking about centering equity and centering family togetherness in this relationship between child welfare and TANF through a lens of data, and looking at that together and making meaning of that data together. I think sometimes we're looking for a technical solution, and a technical solution would be fabulous. And until we have one, we have the people, and we are the people. And I'm going to turn it over, I think, to Sharon or to our next speaker to really talk about how do we bring the heart and the collective strategy together to think about these two funding streams and the data from each to point us in a direction that keeps families together.
Thanks, Claire. I will go ahead and share my slides with everyone so we can dive into this topic. Can you all see slides up on the screen?
Yep.
Looks good? Okay, great. Well, thank you all so much for having me here and letting me just get a little preview in this intro of what you all are thinking about regarding sharing data between TANF and child welfare agencies. Just to introduce myself briefly, my name is Sharon Zanti. I am currently finishing up a PhD in social welfare at the University of Pennsylvania. But before that, I worked for the Colorado Department of Human Services doing data analysis with child welfare, juvenile justice, and domestic violence programs. So I'm very familiar with a lot of the day-to-day work that you all are doing and how challenging it can be, especially when it comes to trying to figure out how we share data. So the research that I do really focuses on how we can ethically share and integrate administrative data that are held by health and human service agencies to improve policies and improve lives. And I do a lot of this work as part of an organization at Penn called Actionable Intelligence for Social Policy, or AISP. You'll hear me use that acronym a bit today. What we do at AISP is help state and local human service agencies collaborate and responsibly use their data. Our time for this part of the presentation is fairly short, so I want to make sure we get to the actionable content as quickly as possible. I'll start with some brief background about AISP and a resource we created that we call our Equity Toolkit. Then I'll share some examples of tangible practices from this toolkit that you can implement to center racial equity at different stages of working with data. And at the end, I'll leave with some resources to share that, depending on where you're at in this journey of trying to figure out data sharing, integration, and use, can help you figure out what some of your steps might be. Today's time is meant for everyone in this room and helping you all out. So please chime in if you have a question or a reflection as we're going. If there's something in the chat that someone wants me to pause on, please flag that for me if I don't catch it. We want this to be interactive, so I'll make sure to pause too, and gives us a little bit of breathing room to check in on what we're learning. Sound good, everyone? All right, great. Okay, so what is AISP that I've been talking about? We are a grant-funded initiative. We're based at the University of Pennsylvania, and we support about 42 and counting state and local governments, universities, and nonprofits in the US that are building their capacity to share, integrate, and use administrative data in ways that are ethical and equity focused. And this map up here shows the network of sites that we currently work with. Some of them might be close to areas where you all are. What our work at AISP often looks like in practice is convening this network of different state and local sites to discuss current issues around administrative data use and collaboratively develop best practices and guidance for how we tackle common challenges with ethically sharing and integrating data. And we take a particular focus on data governance and centering racial equity across the data lifecycle. Our philosophy is really that using, sharing, integrating, analyzing data is just as much, and maybe if not more so, about the relationships as it is about the technical aspects of joining and analyzing data sets. And I think that's what Claire was getting at in the beginning here, that there's so much of this that's about relationships, and you all have probably felt that in your work. So we don't just need to integrate data to make better policies and programs. We need to integrate the people who are represented in the data that we work with and the people like you all who use the data. But how do we do that? And how do we do that in a way that centers equity? Back in 2017, and this was even before I joined the AISP team, we had several members of our network of agencies asking these questions. They came to us at AISP and said they really needed help addressing issues of bias within administrative data and thinking about how equity might intersect with their work. So after looking around for guidance and best practices in this arena, we came up short and found that this was a space, this kind of intersection between equity, data use, human services, data infrastructure, that this space was pretty vacant at the time. So we sought funding to support the creation of a 15-member work group that collaboratively developed the core content of what we call the Equity Toolkit, which this toolkit is really about centering racial equity at each different step of the data lifecycle. So in 2020, we pulled this collective knowledge together and published this toolkit. I can drop a link in the chat in a little bit, but if you search AISP Equity Toolkit, it should come right up. When we planned the release of the toolkit, we were unaware that there would be an impending global pandemic, the inequities that would bring to the forefront, and that more and more agencies would be prioritizing equity in their use of data. And then fast forward to today, because of all this energy on this topic, we're now working on a second version of the toolkit that will come out in early 2025. We've also been leading some cohort-based training and technical assistance for 10 sites as part of our equity and practice learning community. These are state and local agencies testing out strategies in the toolkit in real time with real people. And I'm always happy to take questions about how we developed the toolkit, who was part of it, more of that background stuff when we get to Q&A or even after this session. But for now, I want to get us to the main reason we're here today, which is to talk about what's in the toolkit around these practices for centering racial equity across the data lifecycle. Okay, so this toolkit is organized around 6 stages of the data lifecycle shown on the screen and discusses positive and problematic practices for thinking about and using data at each of those stages. What I'd like everyone in the room to do is take a moment and visualize what parts of the data lifecycle you touch in your work. Maybe it's just one part that you focus on, or maybe you kind of touch all of them. And even if you don't think of yourself as a data person, I bet you probably work with data every day in some way. Maybe you're entering or reviewing case notes about families you serve. That's working with data. Maybe you create reports that other people read, or you review reports that were created and approve communications that have data before they go out. So think really broadly. We'll pause, moment of silence for everyone to just digest this, take this in and think about it. And when you're ready, go ahead and just tell us in the chat, which stages of the data lifecycle do you work with? analysis, reporting, planning and analysis. Okay, a lot of people are touching planning, analysis, reporting. Okay, we've got a data access in here. That's an important one. Data collection. Almost all. Yeah, I think sometimes when you really think about it, you could probably make a case for touching each of these in some way from most positions. Planning, collecting, analysis, reporting. Okay, so we've got a lot of representation in the room of the different data lifecycle stages you touch. Let's keep moving. So one of the most important questions we're asking with this toolkit is, where do we need to center racial equity when we work with data? And if you take away one thing from this talk today, what I hope it is that the answer is everywhere. So no matter where you are in your work or within your organization, no matter which stage of life cycle you work with most, there's a place for you to do the work of centering racial equity in data use, and you could start doing that today. You probably are doing some practices already without even framing them as such. Our biases, the biases within actual data, can appear throughout the life cycle of a project, so there's work to do at each of these stages, no matter where you fall. When you pull up the toolkit, you're going to see a graphic like this on the slide here for each stage of the data lifecycle with positive and problematic practices. These are concrete things that you could take back to your team or just to your own desk and start working on to figure out where there's traction and possibility for centering equity and how you're thinking about and using data. And so on the next slides, I'm going to walk us through an example for each stage, but know that this is just scratching the surface. There's much more in the toolkit. I'm going to mainly focus on some positive practices on the screen, but I also want to at least visually include some of what we refer to as problematic practices, so you can get a feel for what some of those look like. And we're going to start with the planning phase and spend a lot of extra time here because it sounds like a lot of you all touch the planning phase, and maybe this is where you're at with some of your actual projects right now. But we'll try to touch on each of the phases if we have time. So before you even have data and start analyzing it, you can center racial equity in planning by researching, understanding, and disseminating the history of local policy, systems, and structures involved. And even if you are a one-person data team, this is something that you could start working on today to center racial equity. And I can share an example of this from my own work that's relevant here. So I've been part of a federally funded TA effort the last several years called the TANF Data Collaborative, where we work with state and local TANF agencies on analytic projects. And a colleague and I put together a training webinar on this very topic of centering equity across the data lifecycle. And in it, I wanted to include a brief overview of TANF's historical underpinnings. We talked about how when TANF replaced Aid to Families with Dependent Children, or AFDC, it introduced work requirements to our cash welfare system that weren't there before. And it came with some pretty drastic cuts to the number of families who were eligible for benefits. But TANF's predecessor, AFDC, was not a program without its own major inequities. Under AFDC, which was in place for a really long part of our country's history, 1935 all the way to 1996, states would use things called suitable homes provisions and other types of program rules to reduce eligibility, particularly for people who are considered undeserving, for children of color, and during times of labor shortage. Now, when we have this type of historical context, we could start to see how past inequalities and precedents create some of today's conditions. And we can move from being tough on people as individuals to tough on systems. What I found in this presentation to this national TANF audience is that there were many folks in the room, many caseworkers and program administrators in particular, who had been working with TANF for a good chunk of their careers, but hadn't heard most of the history we talked about and definitely weren't thinking about it on a regular basis. So what I'd like to do now is in the chat or out loud, if anyone's brave, what are some other policies, systems, or structures that are relevant to your work here? We just talked about some high-level TANF policy at the federal level, but what other policies and systems influence what you do?
Well, I don't know if this is a high level one or not. I mean,
Mhm.
I don't quantify it or qualify it in any given way other than it's a policy issue. And what it is we have 6 months in which we can actually use funds to do any number of things across the spectrum of services, TANF, CPS. And that 6 months, during that 6 months, CPS person, family does not have to have their children with them. And we can provide cash assistance, any number of services for that family. But however, because it's only 6 months, it does not give us near enough time to really make an impact. So that's one area that I find quite critical and problematic. If they would increase it policy-wise to a whole year, I think that would make a big difference.
Mm. That's a great example. So yeah, we could talk about like really big, like what's the history of the federal law, but behind TANF for child welfare, but we can also think about, specific rules. Where do those rules come from? How long have they been in place? What was the, underlying motivation for some of these rules? Is it to limit benefits in some way? Was it to create administrative burden? Or, was it to try to most efficiently use the resources that are available? So we could think about these questions when we start to name the types of policies and structures that influence our work. Who else has one? Either out loud or please share in the chat. Feel free to just stream of consciousness, list them out. There's no wrong answers. And I am a social worker, so I'm comfortable with silence. Oh, I got a request to repeat the question. So just to list out, what are some policies that impact your work in TANF for child welfare, or structures that you work in, which could be like your organization?
I don't know if this is accurate for other states on the call. I'm guessing it is, but we have state laws that limit our ability to work within federal regulations. So some of the flexibilities in federal regulation are limited by state law. And I know that we try to find ways to make sure that we're still serving our clients the best that we possibly can, but having to recognize that we're not maybe able to fully take advantage of the flexibilities available in federal law.
Mm-hmm. That's a great example. Thanks for sharing. And we've got another one in the chat. Oh yeah, that's a great issue to raise here. There's a common thing that I think anyone working in government will run into is the idea that it's always been that way. And so part of this guidance around researching the history of policies and structures is to, maybe try to move beyond that response of it's always been that way and to understand, well, why has it always been that way? How long has it always been that way? For a year, a decade, 5 decades? Yeah, there can be myths about some of the policies and rules that become, ingrained into like practice and how we do things or how we operate culturally, but maybe they're not even required. So what I really want to underscore here is that there's a lot of power in doing some digging into the policy, systems, and structures surrounding your work with data. And having this can really deepen our insights and perhaps shed some light on some of the underlying inequities and why they might be happening. And I saw a lot of you touch the planning phase. Maybe some of your efforts to share data across agencies are just kind of kicking off the ground right now. This is something that you could do or work with someone on your team to do. I've seen some organizations and agencies draw on an intern that they have who's looking for a research project to try to bring some of this historical context to the conversations. All right, we're going to keep moving. I want to cover one more thing for the planning phase. So planning is so important because it sets the stage for the rest of the data lifecycle. And it's not really talked about, I don't find, nearly as much as things that happen at the end of the life cycle, like data analysis or using algorithmic tools, or everyone, of course, wants to talk about AI right now. So I want to share one more practice that you could take with you that's really foundational for thinking about equity and data use. On this slide up here, we have an example of a benefit risk matrix, which is a really great activity to do with all your partners, stakeholders, providers, community members, community boards, to help determine what types of projects or analyses to prioritize. There's probably 100 different analyses we could do at any given time, but how do we figure out where to go first? So the matrix up here represents just one example from one community's ratings for how risky and how beneficial different types of analysis projects are. The further you go right on the bottom, the higher the risk associated with the project. And then the higher you go up vertically, the higher the perceived benefit. So for example, on the bottom right, we have linking biometric data like facial recognition data. This is a highly risky use of data because it's very sensitive. And we know that there are a lot of inaccuracies in these types of data, particularly for people of color. Facial recognition at this point does not work as well across races. So this community, when doing this activity, rated this type of data use as pretty low benefit as well. And you can see that everything in this red box here are projects that are risky and that are probably not the best place to start. And then on the opposite end, in the green box way up here, are data projects that have a lower risk in this community and a really high potential benefit. Includes things like mapping indicators to figure out where we're going to allocate resources, doing program evaluations, and deduplicating records of people in our systems. Risk and benefit are going to differ a lot depending on where you are. This is not like a guide or like the right answers or anything. It's going to depend on what data are available, how high quality the data are, what tools you have to share the data securely, who's being served, and what some of the history is there. Going back to what we just talked about, like the history is important to bring with us. But this is a really great activity to map out potential projects and prioritize them, and a great place if you're looking for how do we get the community's voice into what we're doing, bringing them into the stage to inform some of this conversation is a great step. Now, if anyone has an example that we could talk through, great. If not, I do have a general one we could work with, but I would love to maybe go through an example that's more specific to what you all are working on, that we could talk about plotting on this matrix somewhere between risk and benefit. So I'll pause and see if anyone has an example, but if not, I'll pull one up.
Is this in reference to the policy regarding data collection? Or
So
what necessarily?
That's a great clarification. Thank you. So a proposed use of data. So if anyone has an example of like right now, we're trying to decide if we're going to share data between TANF and Child Welfare to do X type of project. And I've got a general example on the next slide to show you what I'm talking about. And maybe we can talk through this one first. And if anyone has another one, we could go to that too. So I think this example up here is probably something that's familiar territory to most people on the call, but how would you and your community, your stakeholders plot this use of data? We're talking about sharing data between TANF and Child Welfare to try to identify families currently receiving services in both programs, maybe in like one county or jurisdiction, and doing targeted outreach to those families about a new childcare program. So take a second to like read, digest that.
Wow, it's interesting. We are in, and this has a lot to do with your example here. We're developing an early childhood learning childcare center, and because we operate on the reservation, but our childcare system is across the state. There's 22,000 members. How to arrive at recruitment and who exactly are you going to recruit from the data perspective? Where are you going to get that data? So we went to the state, and the state doesn't necessarily have that data, and we have a a data sharing agreement between TANF and the state, but it was never thought that we would need that kind of. So we run into a lot of problems in terms of just collecting data, basic data from the state, because I mean, 1/3 of our members live on the res, and the 2/3 live over there. So this is a good example for us.
And so where would you plot an example like this in terms of the potential risk?
Well, for the most part, jurisdiction is a big issue. The state always tells us that because of the jurisdiction issue, they don't want to, like, for example, we were trying to set up a child support enforcement program, and years ago they said, no, we can't do that. We can't help you with the TANF program, even though it was in our agreement. They just blankly refused and said, because of jurisdiction issue, we cannot interact with your families that way. So that's a risk issue right there that they've brought up.
Yeah, so in that context, it might be higher risk versus in another context, it might not be seen that way. What about thoughts from anyone else? Just kind of thinking generally about sharing data between these programs to try to do some targeted outreach about a service. Oh, this is a great point in the chat. Worrying about risk to families who associate harm with child welfare over surveillance. Yeah, absolutely. And so some of this will come down to, like, who is getting access to these data? How broad is the group of people that are going to see the data? Is it going to be shared with any other agencies outside of these two parties? Is it going to be like a one-time data sharing effort, or something that's going to be more routine and part of practice? What about benefits? And one thing I'll caveat with risk is that part of this really depends on knowing your context. Like, what are the politics where you're at? What is the history of harm with communities? Yep, benefits we might get. Giving families access to resources that maybe they didn't otherwise know about or know how to access. That could be part of doing some repair with the community. Another thing you might insert into this conversation of, okay, well, we've named a couple of risks that are specific for our community here. What could we do to mitigate some of those risks? Might that include increasing data security measures or having agreements for how long the data sharing is going to go on and who gets access to it? Do we trust them? Okay, that's a really great risk put in here, that sometimes other communities aren't happy about that. Showing some preference, maybe want to know why you're not getting a service or a program. These are all really great examples. I'll keep us moving, and I want to do a time check because I know we got started a couple minutes late. And we've got some wiggle room from Q&A. So for the leaders, what time do you want me to end by? Because we could zip through the last few minutes of this.
You've got probably 5 to 7 more minutes with QA.
Okay, well, we'll keep going, but these slides are here for you. I can share them with everyone. The main point with this planning phase is just that, like, even in this short time period, we're talking about like a hypothetical example. We talked about a lot of nuance to cover, and this is a great place to do that trust and relationship building and to kind of demonstrate at the front. We're thinking about the potential downsides to something that at first blush might sound really helpful, like if we're the one who came up with the idea, but there might be risks that we're not thinking about that our community partners, stakeholders can raise for us. Okay, so let's quickly run through some examples from other stages, because I think we have folks on the call who touch all of these. For data collection, we want to remember that collecting lots of data just to have it for no particular purpose is not only a lot of extra work for you, but it can also put people at risk. So if you're keeping highly sensitive data on hand and not actively using it to drive some type of change or improvement to policy and practice that benefits people in the data, then that risk may not outweigh the benefit. For example, if you're collecting data about documentation status of a child's caregiver just to have it in case, without trying to use that data to systematically provide some important resources or supports, that could be putting families at risk with no clear benefit. When thinking about data access, having an accessible data request process with clear policies for submitting requests and how requests are evaluated is important. If your process isn't intelligible outside of a research audience or people who have a special in, you might be preventing most people represented in the data from understanding how their data can be accessed and making it unlikely that you'll get data requests from diverse parties. Now, in TANF and Child Welfare, a lot of data collected is just for internal decision-making and isn't requestable for a very good reason. But for data that could be requested by a local nonprofit or maybe other community partners that aren't as closely connected, having a clear process is key for equity. And same thing goes for individuals. How can we make the process of requesting your own data clear and empowering? Let's briefly touch on algorithms. Not all versions of a data lifecycle are going to break this out as its own separate stage, but this is such a hot topic, so I like to give it explicit discussion. One of the key recommendations here is that if you're using an algorithm, we want to think about what the specific benefit is to the people whose data are feeding the algorithm. So for example, let's say we have an algorithm that predicts which children are most likely to have an out-of-home placement. Once you have that type of list, what do you do with it? Are you prepared to deploy an evidence-based intervention that's going to significantly reduce risk of out-of-home placement? Have you thought about some of the neighborhood level factors influencing placements, like exposure to violence and unsafe housing conditions? And what might you do about those? Are you prepared to do something about those? And how do we do all of this without blaming individuals or communities for factors that they can't control and without stigmatizing communities of color and people that are living in poverty? And we brought this up before. Is there a chance interventions will end up increasing surveillance and policing of families rather than truly helping them keep their kids at home? So before proceeding with something like a predictive algorithm, our recommendation is to be clear about what the benefit is to the people in the data being used by the algorithm, not just the benefit to the system, and how those benefits will be measured and evaluated. We should also be clear about the potential risks, like we talked about before, and how we're mitigating them. Real quickly, we'll cover a tip for data analysis. When analyzing data, one practice that can help us center racial equity is using mixed methods. Administrative data are very imperfect, as many of us probably know. They contain bias, they lack important contextual information about people's experiences, they can overshadow unique differences for smaller populations especially. And this is where qualitative data can come in, and we can strengthen the rigor of our quantitative analyses and conclusions by drawing on multiple ways of knowing and trying to collect other forms of data. I do have an example, this one we could talk about later if anyone's interested, but for now, we'll cover the last step, reporting and dissemination, and then conclude. So in the final phase, reporting and dissemination, we want to make sure that we communicate findings back to communities whose data are represented, and that we make findings from data analyses speak to different audiences. We want to have more outputs than just a dense report or a publication that goes behind a paywall, because those only speak to a really narrow audience and aren't likely to be accessible to most of the people our analyses concern. Some organizations might do things called data walks or data galleries, which is basically a community event where results from analyses are visually displayed and community partners can come together to review and discuss the results, share ideas about how we might interpret them, talk about trends and why they might be occurring. It's a really good community building event around data. You can also go to community partners and share results in their existing forums or meetings. And the key point here is really to think about all the people who are in the data you are using and what would speak to them And what extra steps could you take to make sure that they get to see the results that could benefit them in some way? Okay, so to wrap us up, I want to leave us with a few quick pieces of guidance that are very simple, but they really come up all the time in the work we do at AISP with state and local agencies, thinking through these same problems that you all are at. One is, I like to tell people to go where the water is flowing, find out where there's momentum for change, for thinking about equity and data use, and start there. There are many, many barriers that feel overwhelming to tackle in thinking about equity and data use. So don't start with those. Start with where there's some traction already. We also recommend starting with a data sharing project that is small and manageable and has the potential for a quick win, rather than starting with something really grandiose that's going to require like a whole new technical system in order to implement. As we've talked about, I think the number one theme here is that relationships are key to this work. Relational challenges are also often harder to solve than technical ones, so work on building relationships wherever you can. And thinking back to this risk versus benefit matrix to help you prioritize what to do with your data, map it out. Think about potential risks and benefits, and then layer in where that water is flowing, where there's traction for change, and what your current capacity is. Okay, I will leave us there on this last slide. Here is just a resource when you look at the slides later in terms of a couple of like foundational resource documents that might be helpful to you and that you can take after this presentation to just help you get started with whatever data sharing and integration challenges you're experiencing.
Thanks so much, Sharon. That was a really wonderful presentation, and this toolkit has so many amazing resources in it. I just wanted to say we have about 2 minutes for Q&A. So welcome any questions. I think we've addressed most of the questions that came up in the chat. I did have one question, Sharon. We often hear that confidentiality issues are a barrier or challenge when it comes to data integration or data sharing. And I'm wondering if you have any strategies or recommendations you can share.
Sure, like mainly about the legal challenges that come up when trying to figure out data sharing and integration. That's probably the most common challenge that people have. And the high level answer that I can give on this is that, like, while I can't give legal advice, and no one can really give legal advice except for your general counsel that's like really familiar and ingrained in your context, is that in general, sharing, there are like 2 ways to share data and information that are generally permissible. One is sharing aggregate and de-identified data. So you might have a project that you envision that like you really want to share individual level data to help with case management. That's a higher bar to clear legally in terms of sharing data, but maybe you could bring it back a few steps and think about, well, what if we shared de-identified aggregate reports that talk about not who specifically is overlapping in caseloads, but how many people, like basic descriptive statistics about the people that are in our TANF caseloads and our child welfare caseloads. Could you start with something like that, show the value and the benefits of being able to share that data, what type of decisions it can help you inform, and that might help you make a case for going to the next step of what we also want to be able to share individual level data, because here's what we weren't able to see from that. The other generally permissible use is sharing data that is necessary for service delivery or program administration. So you can think about data sharing from that angle. How is this proposed use of data and sharing data across agencies, how is it helping us administer our programs? And so coming at it from that angle and making a case from it there might help your legal counsel or others see how this use of data fits into the law. But again, all this is super context specific. The most strict law applies. So there's federal level laws and policies, but then we get down to every state and jurisdiction has ones that layer on top of that.
Really appreciate that. I think that was really helpful. Thank you so much, Sharon, it looks like we have to move on now. If anyone has any questions, please feel free to put them in the chat. I'm sure Sharon can always answer questions that come up. But now I'm going to pass it to my colleague Leanne Heaton and Jennifer Holman from Oregon to share about some TANF administrative research studies that will be moving forward there.
Great, thank you. Can everybody hear me?
Yes.
Yep, great. Thanks, Yasmin. So good morning or good afternoon to everybody. I'm Jennifer Holman. I use she, her pronouns, and I'm the Family Preservation Manager for the Oregon Department of Human Services, and I work across both child welfare and self-sufficiency, which is what we call our TANF program. And I am also on the FAST LC team for Oregon as well, so excited to see all those folks here. And I'm also here with Leanne Heaton, who Yasmin indicated is a research fellow at Chapin Hall. So we're excited to share with you all today just some information about what families are experiencing across our TANF and child welfare programs in Oregon, and what they're telling us are crucial services that they need. And we're excited to share one step that we're taking as an agency to be accountable to that information. So we have a few initiatives currently happening centering around TANF in Oregon. One is the FAST LC, the learning community, and that's a project we're doing across child welfare and TANF programming around a framework to support and sustain innovations that we're looking at to transform both of our programs working together. The second one is a TANF policy, a state policy agenda, and that's where we're looking at the ways TANF impacts families prior to, during child welfare involvement. An example would be, I think one of the other folks on this call talked a little bit about earlier is TANF to families whose children are in foster care, and really looking at understanding how to continue that and for how long. And then thirdly, that both of those kind of lead us to this third initiative that we're going to talk with you about today around needing to integrate our self-sufficiency or TANF data with our child welfare data. So one way that data has been collected is through our Thriving Families initiative in Oregon. So we have a parent advisory council that's made up of all folks with lived experience with our self-sufficiency and child welfare programs. And they began collecting data directly from families. They created a survey for folks who have experienced our systems and to hear what they thought they needed and was most helpful. So you'll see on this survey that the response was high. So we got 343 folks responding to these surveys, and just under half of those respondents were currently receiving services from the Oregon Department of Human Services. And then an additional 28% have received services within the last 12 months. So we're really pleased to get that data from folks that are currently experiencing systems. I think that's one thing that our last presenter mentioned as being a really a positive part of data collection is when you have really recent and current information from folks. So the folks that were surveyed, really you can see the main form of engagement that they have with our agency is through our SNAP and TANF programming. And then further, if we look at the next slide, we asked families, you know, what services or support does your family depend on for survival? And you can see that TANF came in as the third service or support that they really depend on for survival. So placed really high up there on what families are saying that they need from our agency. And then on the next slide, Oregon has a large rural community in our state, and we also have a very condensed urban population. And so a lot of times what we're providing is pretty different around the state. But what we saw in terms of the most needed supports in both rural and urban areas of Oregon, TANF rated in those most needed services across kind of different areas of the state. And lastly, we see that families who are or have experienced child welfare told us that one of their greatest needs prior to involvement with child welfare was economic and concrete supports. And a really interesting example of this is in our family preservation work, where we're working across child welfare and self-sufficiency to really understand what is needed and what is best practice around keeping kids and families together, is that 75% of what we are providing to families is economic and concrete supports. And 25% are really around change services. And that's a big switch for our child welfare folks in terms of thinking about what's been impactful for families. And that has really also impacted our re-abuse rate in terms of folks coming back and engaging with child welfare. So in order to fully understand how we can serve families better prior to child welfare involvement and during that involvement, and our goal being that families never have contact with child welfare when possible, is that we need to be able to integrate our self-sufficiency and child welfare data, which is not integrated at this time, to really have a complete picture of what families are needing. And so I'm going to hand it over to Leanne to talk about how we're partnering with Chapin Hall to do that.
Yeah, thanks, Jennifer. Excited to be here and partnering with Oregon. As Jennifer mentioned, it is difficult in many states that we see and support across the country for programs, particularly public benefit programs in child welfare, to figure out ways to join their data. And Oregon is no exception. We've been in partnering with Oregon on a variety of different large-scale policy projects over the few years. And what we decided is, you know what, we really could support a research project in partnership with the program leaders across both of these programs, with the goal to really generate insights that would improve services, both for families who only receive TANF, but those who we consider dually involved. So those that at some point have received TANF and at some point have been involved in the child welfare system, or what we would consider child protective services, foster care, etc. So we proposed that why don't we take a look at data, and why don't we as researchers link it together and see if we can answer some questions. We hope to use these findings practically to inform policy redesign, but also interventions that might better address the material needs of families in Oregon. But there's more to this project than just research, and I want to say a little bit more about that in just a second. So the next thing that I wanted to share is we worked on these questions together in a working mapping session back at the end of last year. And we talked to both self-sufficiency and child welfare leaders, and we kind of we asked them, you know, what kinds of questions do you really want to know? And so what we did is we took all that information and we crafted them into 5 research questions. First, and we heard the earlier presenter kind of talk about this, just some basic descriptives. Can we characterize families that interface with both systems? Can we also characterize the families just by demographics and other kind of geographical characteristics? And can we look at child welfare outcomes, those that are involved with child welfare and receive TANF? So that's just the first question. The rest of our questions are really centered on differences, and if we can understand differences between dually involved families and families only receiving TANF, both on the demographic characteristics, but also around service needs. And not only service needs and demographics, but we would also like to understand what service components of TANF might be different between dually involved and TANF only families, and then what effect of specific TANF program components have on child welfare outcomes. Now, this is an ambitious research agenda, if you will. The reason why I say that is We know from using administrative data, and anytime you try to link it, that multiple challenges expose themselves, particularly data quality issues. So we fully embrace the idea that we may not be able to answer all of these questions. But we're going to learn a variety of things that we think will be helpful. So we consider this just as much an applied problem-solving project as it is a research project. So I want to say more about that in just a second. But let me just share you some of the data sources that we're going to start with. And we've had numerous conversations with analysts, both on the TANF side and on the child welfare side, to try to put together what we think we can use in this project. So on the TANF side, as I mentioned, we'll be looking at 10 years of data, administrative data for both programs. Why are we looking at 10 years? Several reasons. One, 10 years allows us to adjust for something big that happened in a policy landscape in 2018, Family First. So we want a period of time before Family First was codified in legislation and then implemented in Oregon, or at least the discussion started. The second thing is we want to also know that sometimes data changes in administrative systems, particularly when you change from one legacy system to a new system. And so having lots of years of data can help us kind of figure out what changed and what do we have now versus what do we have then. And the third thing is we need to understand what happened before COVID, because there is an impact and we see it all the way through administrative data, and then after COVID. So 10 years of data will give us the ability to do that. So we're going to look at the type on the TANF side. We're going to look at the types of assistance received, the amount and the duration of that assistance, and then the reason or the amount of the reduction, if there were any reductions. On the child welfare side, we're specifically focused on 3 outcomes. Any sort of referral, and we consider that child welfare involvement, whether it is screened in or out. It does not matter to us. We simply want to know about referral. We then want to know about investigations. Whether it was substantiated or not really is irrelevant. We can look at that, but we want to know, was it actually accepted for an investigation? And then we want to know about placement types. Was there any sort of out-of-home placement? So those are the primary outcomes that we're looking at on the child welfare side. But then we also just want to add that we intend to bring in contextual information. There are other publicly sources of data that are really important to kind of think about how you understand and explain any findings that we come across. And some of those really important public sources are data related to unemployment in Oregon, poverty rates in Oregon, and then also housing instability. We also know that qualitative and specifically family insights are going to be really important. So as we build this data set and we get more clear on what we can and can't do with it and which questions we can and can't answer, we do hope we can go back to this parent-led advisory group and talk to them about this project to kind of get their insights on, are we missing something? Are we thinking about this the right way? And as results come in, we also want to get their input on how we explain the results or understand the findings. So we feel like that contextual framing will really help provide critical insight from families and hopefully reduce some of the risks that we heard that can happen when you kind of undertake this effort without thinking about those that it may impact. Okay, so one final thing, and then I want to talk about what we really see the benefits of this study. We do intend to conduct some sub-analyses, and these were also things that Oregon requested. So for example, when we think about dually involved families, the order in which that involvement happened is important. So did the child welfare precede TANF or did TANF precede child welfare? We also want to know the length of time they might have received TANF before the child welfare involvement and the number of TANF spells. So how long have they been on TANF? Short, longer durations. And then we're also intending to look at more contextual information on the child welfare side, such as different kinds of placement types, and our findings different, family structure, disability status, and then differences between foster care, placement, and family preservation. So these are just the high level overview of what we are planning to undertake if we can, and it all depends on what that data looks like. But in the end, as I mentioned, this is more than just a research study. It has multiple benefits. Having supported a number of jurisdictions over the years trying to implement things and integrate data, one of the best ways we find at Chapin Hall to do this is to actually try to do it and apply it to something. It's really hard to kind of figure out how you're going to integrate data in the abstract. When you actually get people excited about a study and what they might be able to learn from it, and you try to do it, then you get a lot more opportunities to kind of understand really where your data quality and data linking and gaps are. So that's one thing we hope to do with this. We also know that Oregon has a bold plan to kind of hope to do something related to policy in their next legislative cycle. And we hope that some of the information that we learn through the study can inform that legislative agenda. It's particularly important for Oregon administrators have said to us, if we love seeing the national data, but we really would love to have real-time Oregon data to go in front of our legislative body. So that's another use, we hope. We know that clarifying the differences between children and families that are TANF only and dually involved can illuminate things that we may not have considered. One thought that we have is perhaps there aren't really much differences between those families, and it may depend more on the service delivery context than anything else. We don't know that, but we hope we can learn. We also think this is a really good way to inform a dashboard that linking these two sources of data. Sometimes it's really hard for people, again, to kind of think about, well, what do I want in a dashboard? Trying to do an applied project like this, get people interested in trying to get the questions answered, it almost always illuminates something that, hey, I want to track this regularly, or wouldn't it be great if we could understand more about this regularly? So we hope it would inform dashboard development. And then, of course, at the end, we hope that it will inform policies or directives to customize services that are specific to dually involved versus TANF only, and inform strategies to keep families who are receiving TANF from becoming child welfare involved. And so that's all that we have to share. Jennifer, I don't know if you have any last thoughts, but I will stop sharing and seeing if there are questions from the audience.
No, this is Dana again. I appreciate it. Thank you so much for sharing this, because I think it's great. And I think to be able to get this kind of aggregate data can help you think about the issues in terms of what, areas that you might start looking at as a state, and then bringing it down to where county administered to a county. If you could look at that kind of interface that you're doing in Oregon, I appreciate you sharing that. That's really great. We're doing some data stuff, but it's really to evaluate the linkages project, to kind of evaluate the collaboration between the child welfare and the TANF worker, CalWorks worker, we call them here. I hope that gives us some good data, but I love the idea of getting this large state aggregate data for the whole state so that everybody can kind of see. I think it's a fabulous, and I really appreciate you sharing it.
Thank you, Dana. I appreciate that. Alyssa.
I may have missed it, but I'm curious if you mentioned TANF uptake, because that's one of the things that we've talked about a little bit in California, is trying to analyze TANF uptake across different demographic groups, and then integrate that data with child welfare data, and try to get a better understanding of how we could impact the TANF uptake rate, and would that have the kind of impact we'd like to see on some of the disproportionate involvement of families of color in child welfare?
I think that's a great consideration, Melissa. The uptake, we did look at the number of families that are receiving specific benefits and looking across the demographic characteristics. But I love the idea of kind of thinking more strategically about uptake as also a way to understand this. So I appreciate that suggestion.
Yeah.
And I also
I don't
think
know
when
if we're going to
when
be able
we're,
to do it, but I'm sorry, I talked over somebody.
oh, that's okay, go ahead.
I just think it's important to think about those families that are eligible for things and are not actually receiving them, and the prevention impact that could be had on actually getting those services to those families.
Yeah, I was going to say, I think that's a great point. And when we're looking at the order that families receive services as well, one of the points that Leanne brought up, you know, did they have TANF and then child welfare, or child welfare and then TANF?
I like
I think
that.
that's going to tell us a lot as well.
I like that a lot too. I think that's really great. The other thing we're really concerned about is all those families where the parent isn't eligible for TANF and just the child, what we call child only. And you know, what is it? So we're really going to try, we're thinking about that and what can we do, because we want to see if those children are coming into foster care more than other children, and what is it can we start thinking about. So we're really interested in that population. We've just sort of put our toe in the water on that.
Yeah, you know, Dana, I think that's exactly right. And the other thing that you're making me think about is even sort of upstream of that, which is to understand how basic assistance has eroded over time in a particular state, right? Or the ways in which the spending categories have looked different over time, and the extent to which that's having an influence here. I mean, that's getting super fancy. But you know, I think in 96, 68 per 100 people who were eligible for AFDC were getting it. And at this point, it's like 24 per 100 who are eligible are receiving TANF. So it's like the ways in which we just from a volume standpoint are supporting people is quite different. You know, I think that's the point that Sharon was making much earlier. When you understand the history of the funding stream, how it came to be, how it's changed over time, you understand where we are very differently. And so I appreciate both of your comments, because they made me think about something in a very different way.
Yeah, and I just wanted to add one other thing, just going back to what Melissa, you highlighted about the uptake. One of the reasons why we were so interested in making sure that we elevated contextual data as another source, I think there are creative ways that we can kind of figure out, like there are communities we know from different metrics that already exist that are probably likely to have many more folks or many more residents eligible than are probably taking on that particular service. So if there are creative ways that you've thought about approaching that, please reach out, because we are definitely thinking about it. Well, I just want to thank Jennifer for co-presenting, and for the Oregon folks. They've been great thought partners throughout this process, and we look forward to working with all of you on this.
There's no more questions. I can go ahead and close out. Was there anything else, John?
Oh, we actually have one more
Okay.
segment to today's session. So I think we have Pirko.
Oh, okay. My
If you're
apologies.
No worries.
Hi, everyone. So do we have time for this?
Yeah, absolutely.
Okay. Let me see if I can share a slide. Okay, so hello, everybody. I am Pirko Ahonen, and I am with James Bell Associates, or JBA for short. We are a research and evaluation firm based in the DC area, although I telecommute from Colorado. So, so this piece of the session is quite different from the previous one. And so I'm not going to be talking from the perspective of research or study of any kind, but rather from having worked with the Tribal TANF-Child Welfare Coordination grantees for the last about 15 years. So I have been in a role of a project director for a series of contracts under which we have worked with these grant recipients, tribes and tribal organizations. So today I will first provide a bit of a background, then followed by talking about some of the things that we have learned in working with these tribal programs. So at JBA, my team's role has been and continues to be largely around providing technical assistance, although we don't call it technical assistance. We call it providing guidance and support. So to these programs, largely around data evaluation and to some degree around cross-agency collaboration. So I will talk about the TTSW program's collaboration and coordination efforts from the perspective of having worked with these programs for quite a while. So in 2006, in 2011, in 2015, and then again, most recently in 2020, ACF, OFA specifically, has awarded grants for coordination of tribal TANF and child welfare services to a number of tribes and tribal organizations that administer tribal TANF programs. So these coordination grants are providing an opportunity for the tribal grant recipients to implement strategies and models of collaboration, as well as coordination of services that are provided to tribal families who are or may be at risk of child maltreatment. So I would say that in a lot of the what we call grantee cohorts, many of these programs have served dual clients. So families that are simultaneously involved with tribal TANF program, as well as with the ICW or Indian Child Welfare or social services, whatever a particular tribal community calls those programs. So based on the needs of tribal families in these communities, TTSW grant recipients projects are expected to address one or more of the service types that are listed on this slide. So case management for TANF eligible tribal families, supportive services and assistance to tribal children in out-of-home placements and to those families that are caring for these children, and prevention services and assistance to tribal families at risk of child maltreatment. So the focus of these programs really is on collaboration and service coordination with an eye for system change, whereby the collaboration between the TANF and ICW programs hopefully gets institutionalized over time. And the underlying premise, and I kind of heard a little bit about this in the previous presentation towards the end when I was able to join. So the underlying premise is that families that are dealing with economic hardships, so families who qualify for TANF, tend to also be at risk for child welfare involvement. And coordination across these programs can definitely increase effectiveness and efficiency of both systems, and locally designed coordination strategies seem like are more relevant and result in sustainable changes to both of these systems. So from the little I know about your learning community, I do see some similarities in what you are all pursuing and what the TTSW programs have been and are working on. So even though this session is about data sharing, my piece of this is largely about collaboration. So, and as an aside, it looks like the two tribes that are part of this learning collaborative have both been involved with the TTSW grants. The Chippewa Cree tribe of the Rocky Boys Reservation, they had a TTSW program as part of the 2011 grants, and again, as part of the 2015 grants. And the Paskayaki tribe was part of the 2015 grants, and they're also currently part of the current 2020 grants. So here I just have a word cloud of various factors that staff in the TTCW programs frequently report as facilitating collaboration. And I should say that the word relationships should really be large on this slide and stand out, but unfortunately, I'm not really good at putting these kinds of clouds together. So I'll just keep this slide up as a sort of visual while I'll talk a bit about the programs and what they have been doing to create partnerships between tribal TANF and their child welfare programs. And when we get closer to the hour, feel free to just stop me, because it looks like we have about 9 minutes. So first, the TTCW programs represent a variety of collaborative contexts, including organizations that have long-standing histories of cross-program coordination and collaboration in some way, as well as those for whom this kind of coordination and collaboration is completely new or is in its infancy. Each program is unique, but all are focused on maturing collaboration across TANF and child welfare to improve the experiences and the outcomes of the children and families that they serve. Some common focus areas of collaboration and coordination among the current and previous TTCW programs include sustained and consistent meetings across the partners. We all hate having too many meetings, but it does seem that the more they meet, in particular, the more they meet face to face, the more they build trust, the stronger their relationships, etc. And we are all human beings, and human relationships do help facilitate collaboration, coordination, including data sharing to a degree they can within current policies and procedures. So commitment to and scheduling of regular joint meetings are seen as crucial for gaining and maintaining communication and buy-in for collaboration across the partners. Cross-training of program partner staff also is frequently noted by the grant recipients, especially cross-training around increasing understanding of agency and department roles and expanding buy-in for collaboration and joint case management, and training around approaches related to addressing trauma and cross-system communication and conflict resolution. An other area that we hear a lot about from the TTCW programs is the development of shared resources, including tools and forms and procedures and practices to streamline coordination is important. And these examples might include interdepartmental referral forms, procedures that go along with them, shared assessments, and development of frameworks that staff are expected to follow for integrated joint case management, standard operating procedures across the programs, releases of information, etc., etc. Some of these programs are also extending these collaborative partnerships into broader service areas in terms of engaging broader network of providers in coordinating services for families, including tribal courts, educational systems, state and county child welfare and state and county TANF programs, domestic violence and victim services, substance use treatment frequently, transportation divisions, etc. And another piece that we hear a lot about is the importance of working on consistency of shared case planning and collaborative service provision. So a lot of them over time have managed to get to the point where they do provide wraparound services that are provided jointly by TANF and child welfare caseworkers. And in every cohort of these TTCW programs, the staff continue to note and attribute their successes to efforts for maintaining open lines of communication and ongoing building of relationships and trust. Look at the next slide. Here we go. So given that the focus of this entire session is on data sharing, let's briefly look at that component of collaboration. So for the TTCW programs, for the most part, they talk about sharing information informally and formally. Some of them in various cohorts have got to the point where they are sharing data. So why do these programs share information between TANF and child welfare as part of their collaborative efforts? So as many families are involved in both systems in these communities, both the TANF and the child welfare. And while TANF and child welfare do seem to have complementary goals, when these programs are siloed, as they often are, clients are often challenged by conflicting requirements, conflicting service plans, and timelines that can delay or even prevent the achievement of the intended child and family outcomes. So information sharing or data sharing is essential within the context of TANF and child welfare collaborations in order for these TTCW programs to do some of these things. Identify mutual clients. I mean, that is a huge thing for the TTCW programs. To conduct comprehensive assessments of clients' needs. In some cases, there have been programs where TANF intake workers include an intake, an assessment to help identify families' risk of child maltreatment as high or very high. Families that, based on that assessment, are categorized as at high risk or at very high risk are referred to prevention services provided by the child welfare program. Another one is to develop well-informed joint case plans. Another reason for sharing data or information is to track and manage cases, etc., and to determine client outcomes, particularly as most of these TTCW programs have as an anticipated outcome the reduction of child maltreatment, reduction of Native families and out-of-home placements, and so on and so on. Here are just a couple of quick slides again about data sharing. So here are some types of information that TTCW programs share. Some of them share to achieve and address those data needs. So child welfare data examples and tribal TANF data, some examples. But also they aim, and as I noted previously, they do share a lot of information informally. The next slide was just, and I'm not going to go through this given that there's only 2 minutes left, some barriers and facilitators to sharing information. For really true data sharing that would be formalized rather than informal among staff and in joint meetings, perhaps the biggest challenge for these tribal communities has been data systems that either are really outdated and are impossible to use to share data across, and or incompatible data systems. One totally different system with the tribal TANF program, and other totally different system with a child welfare or social services program. So I'm not going to dwell on this one. So so once collaborative processes are in place for sharing information, it is important to have mechanisms in place for sustaining the data sharing that has been established across staff turnover, leadership changes, funding changes, policy changes, etc. So the aim for these TTCW programs is not just to establish data sharing, but to build strong and ongoing collaborations and communication processes and information sharing or data sharing that becomes the way that tribal TANF and ICW work together for the benefit of the families that they serve. So here are some things that the programs have found to be really important in order to maintain the information sharing or even more formal data sharing that has been achieved. One is ongoing training and retraining. In child welfare programs as well as TANF programs, there tends to be a lot of staff turnover. It's important to have procedures in place to keep training new staff, but also existing staff retraining. Revisiting and revising agreements and policies that describe the data sharing procedures, continued emphasis on data and data-driven decision-making, engaged leadership, and just the ongoing commitment are the big things to highlight. And I was going to recap by providing a little more of a summary of what these programs are doing, but given that we're at the time, I will stop now. So who is going to take over? Is that Janelle? Is that John? I don't know.
All you, Janelle.
Okay, I can take over from here. I'd like to thank the presenters, Claire, Sharon, Leanne, Jennifer, and Preco. Thank you all so much on sharing such valuable information and data. Data sharing requires a lot of key elements, but as mentioned, please be mindful when you're collecting data. You're not just collecting it for the sake of data. You know, it creates a heavy workload on staff, and also there's a confidentiality at risk. So, and then I also just wanted to make note, partnership is one of the key elements also in data sharing. So making those connections with other tribal and state staff and reaching out and really utilizing the regional offices for resources. And I also wanted to make note that the June collective TA will be moved from June 19th to the 13th. So thank you all for attending and have a great day.
Thanks all.